one of the important divisions of healthcare, home healthcare, has now achieved a decade of service. But it takes me back almost 50 years ago, when I came back from US. I was really saddened that there was absolutely nothing available, and we were truly a third world healthcare service. So, being a doctor, when you see patients who could have been helped if their facilities were there, and it is not there and we lose them, it hurt me so badly. Especially in '79, I had a young man who was only 38-year-old with 2 children. When he was to go for surgery 2 years because there was no cardiac surgery in India, and so he couldn't go because he couldn't raise $50,000 to go to Houston for surgery. And that's what made me saying, why shouldn't we have it here and give it to our people? What was needed is the human skills. These human skills purely I have seen Indian engineers, Indian doctors, Indian technologists were equal in US. The 10 years which I spent, I don't think in any space, in an Indian doctor or Indian technologist was anything less. So I said, when we have this, what is needed? Then of course, what is needed in a hospital is a backup service. Unfortunately, the government of rules then was that for custom duty to import one of the equipment that we have to save the people at home, it was 320%. It's called a luxury. And Baba, the patient is suffering, he needs care, and you call it pleasure, 320% duty. And then they could fund a hotel, they could fund probably a cigarette shop, but the funding was not available for hospitals. So, but everything was in Delhi. I went many times to convince each of these people, but finally I am happy. Whatever efforts that I took, when Ganesh Del Singh inaugurated our hospital in 1983, September 18, that became a remarkable day for healthcare in the country. Because it's not just for Apollo. Apollo, yes, we have continued and done excellence in every single field of care. It started with cardiac, but we didn't stop there. On day one, they made a multi-special hospital. Today, the care that's given in Apollo Hospital and every single field of medicine is on par with the best centers anywhere in the world. I must speak to I'm a cardiologist, and it started with cardiac surgery. In cardiac surgery, we have done 231,000 cardiac surgeries, and that's the highest number in the world. And in healthcare, it's not the numbers, it is the quality of work. This is what Apollo is proud of. This is what I am proud of Apollo family, who has delivered this excellence in outcomes. Our outcome in heart surgery is over 99%. This is nowhere in the world they have got this. So in everything that we have done, it is because that spirit in each of them, they brought out the inner strength, and that what made Apollo, and now there are another 300 good hospitals in the country. This is why I told our Prime Minister, India can today become global healthcare destination. And sent few suggestions what can be done to make it happen. So he immediately called us, Preetu, Sunita, Sangeeta, and my wife said, why shouldn't I also not come? So she also came to the Prime Minister, but he was on business. First 20 minutes, he said, I like this concept, this is very good, we must do it, and we will do it now. And the only thing is, I want to suggest the name from, I said global healthcare destination. He said, I want to call it as Heal in India, because way back in 750 BC, Shushruta made the first diagnostics and I agreed. I also gave him another paper that there's a huge need of doctors, nurses, healthcare people around the world, in the world. Even India is going to be short of it. So I understood from his secretary that after we left for 1.5 hours, he spent another 2.5 hours to direct the various ministries and work started. And the very first year, he added 49 nursing colleges, 49 medical colleges, 110 nursing schools, and various other technological courses. Today, last year budget, she announced saying there is going to be provision for another 70,000 professionals to be trained. I'm sure this budget she will further increase. Sunita has already met her. I'm sure she would impress saying it. And what I would like to say on this is because we need it and we can do it and we have done it. So this is the three, and then now our aim is Heal in India, Heal by India. My third youngest daughter, Sangeeta, is not here. She started another thing called Heal the World from India. That means we can do the patient's reports come back and then handle them. So I think this is the pride. As an Indian, I am proud now today, saying that there is nothing, no field, whether it's a heart transplant or lung transplant or liver transplant or major neurosurgery, all are done in India. The proton, when we brought proton to Chennai, there was no proton in the UK, no proton in Southeast Asia and Singapore and Australia. So I think what I am trying to tell this is to say that we have come to a very good stage. This is the time we should jump and say, we can help and make India a healthy nation and give it to the world. Because the same, as I said, that the deficiency of healthcare people is about 8 million this decade and 30 million by the time 2040. So I think only India has got the young people to deliver this. So we have that. Similarly in home care, when we thought of it, there was a huge necessity. Because one of the patients told me that if I go home, who will look after me? So I think that's a very nice question that really touched on me. Then the concept came home care. Thanks to the team. Now, thank Jawahar and his team now. We are celebrating a decade of service. We have done a brilliant work. But remember the word what Peter said. Peter said it's a brilliant beginning of the next decade. So there's a huge need for this, and I think I can do everything possible today because the technology is available, and at Apollo and in India, technological services have become very easy to adapt, and our people are very intelligent in adapting this. So that is not at the back. And as an institution, we are willing to back. Apollo today is like a banyan tree. There is nearly about 17 branches. Each branch like this is going to make a significant impact in giving the services to people. And I think my Apollo family worked so hard. It's only one purpose, saying the patient is tested and come to me. I must do the very best for them. Very often, the nurse or the doctor has not left her because it's 5 o'clock on his duty or his over. So I think that's the only thing which helped us to achieve this level of healthcare delivery in the world. God bless all of you. I assure you, the Apollo family will be continuously part of your family to keep you healthy and happy.
Most importantly, Harshad, Dr. Vishal, and the whole Homecare team. I'm so happy and delighted to be here. 10 years has gone. I say that it's been a very meaningful 10 years, and to make a significant difference in people's lives in multiple ways. You know, sometimes in a hospital system, the nurse is part of a large system. The caregiver is part of a larger system, and there is this blanket of a high-end tertiary care center which you can always fall back on. And sometimes when you go into the home environment, you're not so close to this, into this big hospital system. So the responsibility on that caregiver is so much more. And sometimes we don't tend to realize it because patients' families expect that, and I think they deserve to get it. But here they're looking after them in that environment, and for that I must congratulate the entire team for doing it and doing it so well over the past 10 years. Most institutions come into being because there's a crying need in society to do something and to serve, and we will see that happening time and time again, that these institutions leave a lasting legacy behind. When we started Apollo Hospitals, when Chairman came back from really a very good and a strong practice in the US to come and serve his nation, because there was a need in society. When Apollo was started as a hospital enterprise, there was a need in society for that level and that quality of healthcare. When the pharmacy started, when digital started, when the clinic started, everything started because there was a need in that area. And this is a very specialized baby, maybe because it's only 10 years old, the way it is now, but that's because there is a huge need in society. And you heard from both Harshad, from Sunita, from Vishal when he spoke, that we really have to do this, and we do it because there is a responsibility from our side to do what we have to do consistently with the highest level of quality, the way Madhu said, zero harm, to just focus on outcomes, because I think that is the numbers which we're all looking at, that the outcomes have to be phenomenal. We have to make that difference. It is not just providing interventions for the patient, but to just be a holistic provider for them. And to me, that is what is going to make a huge difference. So this is a promise in the 10th year that we will leave no stone unturned to see that the patients and their families have the whole Apollo ecosystem behind them, taking care of them. You have a display of everything which we offer from just this division. But imagine that this has the whole Apollo ecosystem behind it, and then we have a healthcare blanket, we have a healthcare shield taking care of you, and that is the promise today. Again, we stand by our quality standards. We stand by the fact that, we must make that promise. We want that seal of quality for everything which we do. So we will see that if JCI will give us either a stamp or the standards or the NABH kind of accreditation, and we've got a fantastic CEO in place, and I'm sure that he and his team will find ways to get that stamp of quality so that care is consistent across every ecosystem. I'm glad that we started in Chennai, but we're in 13 cities. But if we can really impact that 1 million lives and make it 10 million lives soon using technology, we would feel like it is just a beginning of a job well done. I think that should be our next goal. And having said that, there's a huge space, a crying need in geriatric care, the way Sunita said, in mental health, because people really need that love, that touch, which a hospital system not necessarily needs to intervene. So we will look at different ways of doing that. We will look at, again, the happy stuff, the baby care, when moms need us in that space. Aftercare, when people go home from the hospitals, And sometimes long-term care, cancer, nephrology, so on and so forth, does not need you to be in the hospital for the everyday care. And maybe you just need a doctor visiting you or a nurse visiting you every day to go back and tell your children. So we'll use technology, we will do that, we will do the visits, and I think we will just make high-end healthcare at your doorstep, in your homes, to see that you feel safe, you feel secure and well looked after. So that is the 10th year promise, and I'm sure the team will deliver on it. Thank you and God bless.
So these are the numbers. When Chairman came back to India in 1970s, the lifespan, the health of an average Indian was 56. Today it is 76. That is the change that we bring. And these are the numbers. These are the numbers that count. Infant mortality has really decreased by a factor of 4. Maternal mortality has decreased by a factor of 10. These are numbers that count because they impact human lives. And that's what Apollo does. It is an essential part of our DNA that we are here for a single purpose. And that purpose used to be the patient, but today it's the customer, it's you, it's me, it's everyone whose lives can be improved by interacting with the system that is Apollo. So we might have started as a hospital, but what differentiates us is the networks that we've built, the complete ecosystem around the lives that we lead. For example, if you're born, Apollo Cradle is there. You could be born in one of our centers, you could be born in one of our hospitals, and you'll probably go home on the second day with an Apollo Homecare nurse there to look after your baby, which is actually the most challenging thing for a mother. I've seen it with my own daughter. Many women don't even understand that they go through this postpartum depression, and it's really tough taking a child home. I felt it when I was young, and you see it. But it is the Apollo home care that takes you through these difficult periods. When your child is sick, you have the ability to call Apollo through Ask Apollo. That's another part of the network which is really focused on pediatric, on all types of care, using the phone. So we built the ecosystem around the patient, moving closer to the patient at each step. Whether it's a primary healthcare clinic, a diagnostic, so you can have a phlebotomist at home, or whether it's just having the ambulance come to you, getting admitted into the hospital, and then being discharged on the third day because there's Apollo Home Care. So how does Apollo Home Care really remain relevant for us beyond the fact that it helps in connecting the ecosystem of care? I think in today's world, by 2047, 20% of India will be senior citizens. They need care. And as we see life expectancy go up, it is the quality of care that counts. It's not just care, it's not just getting admitted, but it's the quality of care that counts. And I think this is where Apollo Home Care has really established a niche for himself. The second reason, for a very practical reason, is the fact that with the penetration of insurance, and now close to 50% of our patients have access through insurance, we need to discharge the patient on the third day. We want to make it easy for the patient. So whether it's a senior citizen post-stroke who needs help with feeding, rehab, there's so many use cases, or an ICU at home, there is again Apollo Healthcare. So I'm just going to leave it with these three reasons, that we are here to build the ecosystem around the patient, whether it's primary, secondary, tertiary care. Apollo Home Care helps connect the dots, and especially with Ask Apollo and our digital offering, we're able to do this really well. I want to end by saying that, while we are AI, we have the full digital experience that we've witnessed in Pune around the patient. and we amplified it. Actually, we started it through COVID, where we were able to look after 20,000 patients just digitally. That's really where home care excelled. It's a practical example of the impact that it can have, not just on individuals, but the quality of health of a nation. Time magazine had this picture of a child who will grow to be 100. We hope to partner every child in this journey as they grow from 0 to 100. This is what partnership means. India is famous for, they say Atiti Devo Bhava, but beyond Atiti Devo Bhava, if we can be nice to guess, I think the culture of every Indian, the fact that we used to live in joint families, really no one wants to send their senior citizens to a cold nursing home, a place where they have to grow old. And I know it's done in the West, it's more out of necessity. But in our country, I think the human touch matters. And that human touch, the ability to grow old at home, preserving the quality of life, being surrounded by the patient, by the family, that means so much to you. That is the warmth that Apollo Home Care brings. And for me, I think that is what will make it successful and much needed. So thank you, ladies and gentlemen.
Very special moment to stand here with all of you as Apollo Home Care completes a decade in operation. A decade ago, our beloved chairman envisioned that the same Apollo quality that every Indian trusted inside our hospitals had to travel with the patient all the way home. This is how the Apollo Home Care was born, to bridge the gap between hospital and home and to make recovery more continuous, compassionate and convenient. Over these 10 years, the idea has grown into a nationwide platform. What started as an innovation to support post-discharge and chronic care has become one of India's most trusted, technologically enabled, comprehensive home health network. We are here today not just to celebrate a business milestone, but to acknowledge the thousands of clinicians, nurses, therapists, technicians, and coordinators who have carried Apollo into the homes and hearts of more than 1 million patients. Let me first talk about why home care matters so much for India's healthcare future. Globally, care at home is a $400 billion market and growing. In India, the home healthcare market is estimated at $8 to $10 billion, growing at 20% every year. This accounts for 1% of the global healthcare market. That is only 1% of the global healthcare market, and with only 2% of the domestic market being organized. This tells you two things. One, the shift has started. Two, the headroom for growth is enormous. India's structural bottlenecks, unfortunately, make this even clearer. Limited hospital beds for a large population, a gradually aging demographic, the rising burden of NCDs. With 70% of healthcare needs being met at home, care is moving closer to where people live, work, and age. In India alone, 1 in 4 hospitalized patients need structured post-discharge care. That is nearly 10 million patients every year. Serving them also means creating 3 million jobs, many for women. In other words, building India's home health care network is not only about healthcare, it is about jobs, gender empowerment, skill building, and most importantly, nation building. When we began in 2015, our mission was simpler: deliver hospital-grade care at home. Today, we deliver 2,000 plus care episodes every day. We have served over 1 million patients, and delivered 20 million nursing care hours. We are focused on solving India's care continuum gap through a clearer design philosophy. Care that is connected seamlessly with the treating doctor, care delivery enabled by a purpose-built in-house technological platform, and quality of care providers to ensure protocol-driven care. We now run one of India's largest structured step-down and critical care at home programs, supported by our intensivists and remote monitoring. Our discharge to home programs reduce length of stay, improve satisfaction, and consistently meet national and global benchmarks. I see three big shifts in the coming decade as the leap for home care beckons in front of us. First, scale. We have built a strong foundation in 13 cities. The next decade is about depth and breadth. We will deepen our presence in the existing cities we serve and expand into the new clusters. Second is capability building. We will continue to build out the full circle of care at home, offering more innovative and clinically relevant services. Critical care, specialized rehab, palliative care, dialysis and respiratory programs to advanced geriatric and dementia support. We will explore new delivery formats to support our vision of seamless out-of-hospital care continuum, including transition and rehab centers that work hand in hand with home care. We will continue investing in upskilling our teams through simulation-based training and specialty tracks, because capability on the ground is what ultimately delivers outcomes. Third, and most importantly, we would build on our intelligence. The next leap in home care will be powered by data and AI. Within Apollo, we already use AI for cardiac risk prediction, clinical decision support, and connected care monitoring. We are now building an advanced clinical decision support system, digitized protocols, and AI-driven care pathways, especially for out-of-hospital care. As we celebrate our 10-year milestone, I am aware that this comes with a big responsibility, that of solving India's growing care continuum needs. To our teams across cities, I want to say a heartfelt thank you. You enter homes at their most vulnerable moments and deliver compassionate and impeccable care every day. To our hospital colleagues, thank you for trusting and partnering with Apollo Home Care as an extension of your care. To policymakers, insurers, and partners, to build a healthier India, we must build an ecosystem where care does not stop at the hospital gate. As we look ahead to the next decade, our vision is simple. Whenever an Indian family thinks of recovery, a long-term disease management program, of caring for an elder or a loved one after surgery, I want them to feel that they're not alone. Apollo Home Care will be there. Thank you for walking this journey with us for over a decade.